Hey everybody, welcome back to my channel. I'm Dr. Perkins. I'm a board certified OBGYN, and it's a pleasure to have you join me today. We'll be talking about how to test if a woman is infertile. Let's go. You should watch because infertility is a major problem, and learning how to have testing done, the right amount of testing, the right type of testing may give you information that can change your life. In this video, we'll also talk about the types of female infertility that exists. So what is female infertility? Well, at any point along your reproductive tract, there could be a problem that prevents you from getting pregnant. Let's take a look at this. Here, this is Ivy. Ivy is a model of what your female reproductive system looks like in full enlarged. Here's the uterus. The uterus composes this upper portion, which provides for either pregnancy or periods, this lower area, which is your cervix, 2 fallopian tubes, and right next to your fallopian tubes are your ovaries. In the process of getting pregnant, 2 very important things must occur. The first thing is that you must ovulate and create a mature egg to be fertilized. That comes from your ovary. The second thing that must happen is that sperm needs to be present. Now, that happens by sperm entering into the vaginal area, then traveling up from the cervix through the uterus to the fallopian tube, and will meet an egg right in this area of the fallopian tube. If either one of those processes does not occur accordingly as planned, pregnancy will not occur. Now, while infertility is very much a female as it is a male problem, today we're focusing just on the female aspect. If you do not ovulate, you can be considered to have ovulatory infertility. If there is a problem with your fallopian tube, wherein egg and sperm might not be able to easily meet, that can cause you to be infertile. If you have any problems with your uterus, that can include fibroids, having uterine polyps, having a uterine infection, having scar tissue or adhesions within your uterus. This can prevent pregnancy from occurring. The same if there is a problem with your cervix, causing blockage, infection, anything, this can prevent you from getting pregnant as well. If you have been trying for pregnancy for some time and you'd like to know whether or not you should get testing for infertility, let's look at the guidelines. First off, age is a major factor here. If you're under the age of 35, it is recommended that you try to conceive for at least 12 consecutive months. That means that you are consistently having sexual intercourse, especially during your ovulation window, as well as this being every single month for a total of 12 months. If you're over the age of 35, we recommend that you try to conceive in the same fashion for no more than 6 months. The reason we shorten this duration when you're over the age of 35 is because we know that fertility is declining every single day. Every day that you live, the amount of eggs go down every single day, and the quality of your eggs are declining even faster when you're over the age of 35. So timing is essential. You don't want to wait too long before you start getting testing. There are other scenarios as well that we would recommend initiating testing even earlier. If you have irregular cycles, if it is difficult for you to know exactly when you ovulate, if you have other underlying medical conditions, or even a history of pelvic inflammatory disease, these are reasons why you should initiate testing even if you are under the age of 35, earlier if you've been trying to get pregnant but haven't really achieved that yet. The first thing that you'd like to do when initiating testing is see your doctor. I knew you knew that. Okay, very important because your doctor's visit will open up a world of understanding and really a relationship between the person who should guide you and help you to achieve your dream of a pregnancy. During that visit, your doctor will ask you a ton of questions. Very important, because with that, we'll be able to put together your entire picture, be able to offer you the right testing, and guide you along this process and this journey. Some of those questions may be related to your menstrual cycle, how often they occur, and on that note, we want you to know this as best as you can. Knowing your periods and when you ovulate is very important, more so in knowing the periods than it is with ovulation, because we'll help you with that part of it. Knowing your cycles, when they start, how long they are, if they're irregular or not, if they are heavy, do you have blood clots? All of these details are very important. In addition to your family history, genetic histories, medical history, surgical history, as well as social histories. With all of this information, we can prepare a plan for you and infertility. If you're enjoying our conversation today, we would love to hear from you. Go ahead and comment below if you are experiencing infertility, if you know what type of infertility you have, and what treatments have worked for you in the past. Now, let's talk more about the type of testing that can be done to let you know whether or not you're infertile. The first testing, which is really more documentation again, is knowing when you ovulate. In general, you ovulate 14 days before the start of your next menstrual cycle. Now, for someone who is very regulated with their cycles, that becomes very easy. You may have a 28-day cycle, a 30-day cycle, even a 35-day cycle, and that is quite normal. The range is somewhere between 21 and 35 days. Now, if you have irregular cycles, that becomes difficult. And in that scenario, it is more important than anything to document. We can help you with trying to figure out when ovulation is occurring for you or not occurring, but we need details, and the more information you present in the doctor's office, the more we can actually help and assist. The second type of testing your doctor may recommend is being certain that your fallopian tubes are working and what we call patent, meaning that they're open and there is a way for egg and sperm to actually meet. Now let's take a look again at IV. This is your fallopian tube. It is connected to your uterus. Some testing, for instance, a hysterosalpingogram is an X-ray of the pelvis in your uterus in which we insert a dye through your cervix. That dye passes through the uterus and goes through your fallopian tubes. It is a marvelous test of your fallopian tubes because the testing is done in a radiology office. The testing gives you answers immediately. As soon as that X-ray is done, we will know whether or not the right or left fallopian tube is open. If you do have a blockage in your fallopian tube, it will also show you on the results. With that information, it will help us to know how to move forward and what recommendations are needed for you in your scenario. On that HSG or hysterosalpingogram, it may also give us information about your uterus and what the contours and the endometrial cavity is like. That is the space on the inside of your uterus, because sometimes you may have a polyp or a fibroid that is located in that area, and that can prevent sperm from passing through to get to the fallopian tube and cause fertilization to happen. So we're going to continue this discussion in part 2. Join me.